Good afternoon. I'm Dr. Kelly Birkenstock. Today we're going to be talking about a topic near and dear to my heart, dare to be thin. Often people look at me and my 92 pounds and say, what could she know about weight loss? Well, I wasn't always 92 pounds. There's not a whole lot of magic to losing weight, but there is a method. We're going to be talking about that shortly. Dare to be thin. And it's not often I bring this thing out, but today's the day. Okay, so without further ado, welcome to the convention today. It's a pleasure to see everyone. I'm Dr. Kelly Birkenstock. Have an office in Mandeville and in Metairie. Today we're going to be talking about weight loss. There's a million fad diets. There's a million tricks, and most of them do not work. Has anybody ever tried a diet that didn't work? Sugar Busters, Jenny Craig, Aspen. I think I did all three of them. Weight loss is more than just a diet. It is a whole constitution of symptoms, which we're going to go over one by one. So let's talk more about it now. Dare to be thin. Skinny approach, methodology to skinny success. We all know the answer is not just one thing, because if it were, or if it were easy, we'd be there by now. We can do it, but it does take a method, a methodology, and looking at the whole picture. So let me tell you a little bit about what that picture is. Weight loss isn't just about calories consumed, and it's just not about exercise expended. If it was, we would all be at our optimal weight. When we talk about weight, it is based on multi-parameters. Your thyroid, your sugar level, your vitamin, amino acid, and mineral level, whether or not you've got a leaky gut, any food allergies you may or may not have, your hormone balance, and the biggest piece of the puzzle, your DNA. We're going to talk more about why and how DNA affects your weight. When we get into middle age, most of us have a sluggish thyroid. It doesn't mean it's broken. It doesn't mean we have a major thyroid disorder. But if the thyroid is sluggish, it needs to be corrected. The thyroid needs to be optimal. Well, what is the optimal functioning of a thyroid gland? It's when it's a certain two numbers in the blood work, a TSH of 0.5 to 1 and a free T3 of 3.8 to 4.2. When we're outside of those parameters in T3 or T4, which are both thyroid hormones, then the metabolism gets very slow. In addition to that, we can have all kinds of symptoms. Moodiness, dry hair, weight gain, fatigue, rashes, loss of hair, loss of eyebrows. Then there's the insulin and the sugar issues. A little bit of high blood sugar may not be quote unquote full-fledged diabetes, but a little bit of high blood sugar turns on your cortisol, turns on your inflammation, your free fatty acid, and then you're making fat cells. Well, if we tame down the blood sugar, guess what happens? We don't gain all that extra weight. So if we have two people, one is stressed out and eats, say for example, a pancake, and we have someone else that's not stressed out that eats a pancake, the person that's stressed out eating the pancake built more free fatty acid and more fat cells off that pancake than the one that was calm. So stress plays a factor, sugar plays a factor, and insulin, the insulin cascade plays a factor. Leaky gut. What is a leaky gut? This is when your stomach and your gastrointestinal tract, small bowel, large intestine, and stomach are leaking toxins into your body, bloodstream, what have you. What happens when it leaks is that it turns on, again, that whole familiar word, inflammation cascade. And when we turn on that inflammation cascade, we turn on cortisol and other bad hormones that are there for flight or flight. They're there for emergencies, but in the day and age that we live now, they're getting turned on for other things, which are making us gain weight. A leaky gut can happen from so many things: taking ibuprofen, aspirin, any anti-inflammatory pain relievers, Celebrex. It can also happen from taking antibiotics. So we knock out the bad bacteria, we knock out the bad fungus, we also knock out the good. So it has to be replenished. Having physical stress or psychological stress can knock out your normal gut microbes and cause a leaky gut. So even if we were eating the salad, and even if we were drinking the water, we could still be gaining weight. Why? Because of the leaky gut. Because you're not going to absorb your vitamins and minerals. You're going to turn on the craving cascade, turn on the inflammation cascade. Food allergies. So there's a whole complex on food. One of the things is called diet cure, and it's not being on a diet, it's eating a diet that's appropriate for your system. Many of us don't know what foods we're allergic to. A type 4 allergy, a major allergy, is going to cause your throat to close down, major hive reaction, and you know you have a problem. You go to the emergency room and they give you medication, and they give you an EpiPen to take with you whenever you eat that, whether it's shrimp or whether it's strawberries or what have you. If you've got a 1, 2, or type 3 food allergy, you may not even know. Most of the time you don't. The next day after you eat the strawberry, the egg yolk, rosemary, sage, parsley, or thyme, herbs, you wake up with a headache or feel sluggish, or you're snapping at the family and you don't know why. It can be from food allergies. So we have food panels available to us that pull over 200 foods. If you eat a food, this is a pretty demonstrative one here, but for example, if you eat a food that you're majorly in the avoid category, type 3 category, then you're going to provoke the whole inflammation cascade. Say, for example, this particular person on the screen is very allergic to egg whites. So she may think, or he may think, they're doing something very good by buying those very expensive egg white cartons and not doing the whole egg because they're trying to avoid the egg yolk, when in fact they're feeding this inflammation cycle in their body, and the body does not tell them, except via a headache or just not feeling well or feeling bloated, that something's gone wrong. It's not until we pull a food allergy panel that we know in fact that there's lots of foods we have to absolutely avoid. If it's something in the low stage 1 allergy category, you can have those once or twice a month, for example. Then we have hormones, male hormones, female hormones. When your male and female hormones are not in proper alignment, when the orchestra is not playing properly, say for example, if you're young and you've got polycystic ovarian syndrome, or you have severe cramping periods, or you may have cysts in the uterus, such as fibroids, cysts in the ovaries. This is all a clue that your hormones aren't balanced, and that's going to cause things like acne, food cravings, weight gain, through the whole cascade of hormonal events. When we get to middle age and above, we stay in menopause. Once a female loses her monthly menstruation cycle, she's in menopause for the rest of her life. If we don't address that for the female, all kinds of things happen. Cardiovascular problems, bone loss, moodiness, foggy brain. When we correct those female hormones with whatever she may be lacking, and most of the time it's all three, estrogen, and not just estrogen, but estradiol and estriol, progesterone and testosterone, DHEA, sometimes pregnenolone. When we balance those hormones with bioidentical or natural hormones, which you apply topically and you avoid a tremendous amount of the bad side effects of the ones that you swallow, when you balance that cascade, the weight drops off. In addition, the mind gets clear, the night sweats go away, the hot flashes, the libido improves, moods improve. But it's not just women who are playing this game. It's men. Men can go into a state of andropause. Most do, at least to some extent. In andropause, when the testosterone goes down and the estradiol can go up, which is a type of estrogen, progesterone may go down or up, men get fatigued, low energy, weight gain. They get a protuberant or a large abdomen. Their libido goes down. Their zest for life goes down. This abdomen weight gain in the man is very dangerous. It can be and will be the precursor for diabetes sometimes, blood pressure, stroke, heart attack. So for the man in andropause and the woman in menopause, we want to treat those hormones to prevent not only weight gain, but also the deterioration that can happen in midlife and after. Another part to weight balance is vitamin deficiencies. Now, we can have a vitamin deficiency if we're not eating the vitamin. We can have a vitamin deficiency if we're not absorbing the vitamin. Why wouldn't we be absorbing the vitamin? Does anybody remember? I spoke about it earlier. Leaky gut. So if I have a leaky gut, I can eat the asparagus and the broccoli, which are all wonderful and great. But if my gut's leaking and it's inflamed and the good bacteria, the good yeast, the good fungi aren't there, I'm not absorbing those vitamins and minerals from the good diet that I am eating. A third thing, just as important, often overlooked, are the amino acids. The amino acids, like your asparagine, glutathione, NAD. When those amino acids, which are the building blocks of protein, aren't absorbed and we don't have enough of those in the brain, not only do we send out cravings and gain weight, we get depressed. We think we have ADD. We can look schizophrenic and feel schizophrenic. What has been shown is if we replace those amino acids in the brain, a lot of times we can cure the mood and get people off of a lot of unneeded medications. Sometimes not, depends on the type of mood disorder is present. But it's absolutely amazing what can be done in curing the mood, just a metamorphosis of the mind with proper nutrition. So the final piece to our picture is the DNA makeup. We swab you in the oral mouth for DNA. We run that test and we get 24 genes that give us a whole book about you. Not your neighbor, not your sister, not your brother, but about you. And it tells us how your body's built, what nutrients you need to absorb, and how much of them, percentage-wise. It tells us 5 parameters about your brain. It also tells us when your metabolism is faster or slower during the day. That's one of our newest genes. So in general, we always say what? Eat early in the day, because if you don't eat early in the day, you're gonna gain weight. That's true for the majority, but not for the minority. There are some people that's metabolism turns on at different parts of the day or evening. So for them, the proper thing is to eat at that point in the day and not in the morning. And we know that from your DNA. We also, in the DNA, get a lot of information about your exercise potential. So in the DNA, you may have fast twitch fibers, or you may have slow twitch fibers, or you may have a combination of fast and slow twitch. Again, your DNA would show us that. Well, how does that benefit me? Well, if you're built of fast twitch fibers, I need to send you out there doing aerobics, okay? You're going to burn more fat doing what you're built for. Any kind of exercise is wonderful for the brain, the heart, the lungs, the mood. That's great. If we're specifically talking about burning a fat cell, then I need you doing things that are going to open up the oxygen cascade to burn the fat, and that's going to be the way you're built. So if you're slow twitch muscle fibers, I'm going to want you to go for long walks and long bike rides because you're built differently. It's about aerobic and anaerobic and different things like that. Suffice it to say for this conversation, fast twitch, slow twitch. What if you're a combination? Then I'm going to tell you walk around the block and then run up the stairs. Then walk around the block, then run up the stairs. Or that's also known as interval training. Another piece of this pie with the DNA is that it tells you sort of a recipe for how you should lift weights. So if you're a mixture of slow and fast twitch, you would do moderate weights, moderate interval, moderate reps, 60-second break in between. So if I pick up my weights and I do 8 reps with the 10-pound weights, I put it down, before I start for my second set, I need to go do a leg, right? Because I have to wait 60 seconds because my DNA said I'm a moderate. So I need 60 seconds before I pick up the hand weights again. So I do my leg set, then I turn around, by then 60 seconds has gone, and then I do. That may be a little confusing, but it's all in your DNA report. Another important thing, this is how the food pyramid that the American Association puts out about how everyone should eat. Well, if I ate like that, I would look like this again, because that's not how I'm built. That's got a predominant amount of carbohydrates at 65% on the bottom of the rung, and that's got a 15% of fats up at the top, and then meat and dairy, it's got approximately 20%. Well, my DNA report says I'm a 30-30-40. 30% fats. So my top triangle is a whole lot bigger than that, right? It's not really a triangle, but my top portion, fats, 30%. My protein, 30%. I need a lot more protein than they want to give me. And then for carbohydrates, 65%, I'm 40. So much, much less carbohydrates for me. But what applies for me doesn't apply for my sister, my cousin, or my neighbor across the street. It's very individual based on your DNA. So our plan, Dare to Be Thin, to achieve skinny success, it's not a diet. It's not a phase. It's a lifestyle change. And it's permanent. We're going to cleanse you and detox you. We're going to put you on a weight loss phase and a stabilization. And then we put you through maintenance for life. And it works. We have Miss Kathy. Kathy, would you mind coming up? Kathy joined us about a year and a half ago, was it? Yesterday was her 2-year anniversary. Kathy, when you joined us, how much did you weigh, if you don't mind telling us?
193 pounds.
And how much do you weigh today?
155 pounds.
All right, Kathy. Was the weight loss program hard?
No, the most difficult part I had was learning what I needed to eat because I have Hashimoto's thyroiditis. Dr. B and her team helped me with that. So I had to learn what was better for me to eat. Protein, more protein, less carbohydrates. And I never would eat fat. And I wouldn't eat during the day. I would only eat one meal a day, and I thought that's the way you were going to lose weight. And I had to learn how to eat breakfast, lunch, and dinner, and then snacks in between. So that's
And is it enough food? Are you ever hungry?
No, I'm never hungry. In fact, sometimes I'm forcing that last portion in the evening.
Thank you, Kathy, so much. Thank you for joining us. So one of the most important parts of our weight loss program, and it's a life-changing program, undoubtedly everyone tells us it's too much food to eat. It's just too much. So this is just the basics. We cleanse, we detox. We have a lighten up juice. It's a proprietary blend that we have, and that helps you cleanse and detox while you're eating fruits and vegetables and other things that are on the 3-day cleanse. Then you go into the weight loss weeks, which is personalized for you. We have nutritional counselors that are there for you to give you support. So if you're at the grocery store and you don't know what to buy, you text them and they're going to give you direction on that. Then we have a maintenance for life. So it fixes it for life. This is Charlie. He's lost over 100 pounds with us. He was one of those people that fasted all day, went home at night, and then the binge began. He works a very, very heavy exercise-induced job. So he just couldn't understand why it was so hard for him to lose weight. But it was based on he was eating entirely wrong for his DNA matrix, and he was eating entirely wrong times of the day. Here's Zamora. She's lost 86 pounds. She's still maintaining. And there's Miss Kathy. One of the most important foods out there that is absolutely toxic to your brain, toxic to your body, and toxic to any attempts to maintain weight is high fructose corn syrup. Is everybody familiar with that? Sometimes it's called corn syrup solids, high fructose corn syrup. It's found in every Kellogg's cereal, Miracle Whip, lots of different salad dressings, Nabisco, many of the Nabisco wheat thins and chips and all kind of things. It's found in most peanut butters. They've finally started making some peanut butters, and they'll say clearly on the label, no high fructose corn syrup. The best peanut butter is when you walk to the machine and press the button. The Rouse's stores, Whole Foods, and Fresh Market have that now. So you're getting no salt, no chemicals, no preservatives, and you can make your own peanut butter. This one has the high fructose corn syrup. Chex Mix, full of corn syrup solids. Donuts, of course. Pancake mix, pancake syrup, ketchup, mayonnaise, just a few things. So when you're picking snacks and something good to eat, you want to go after things that don't have chemicals and preservatives. Greek yogurt, slice of cheese, nuts, and of course, any fruit and vegetable. Thank you. Look in the light.
Ladies and gentlemen, welcome Dr. Birkenstock.
Good afternoon, everybody. I'm Dr. Kelly Birkenstock. I speak on a lot of venues. Yesterday we spoke on weight loss and the 8 parameters that help you lose weight. We're all about beauty, and beauty just isn't in the makeup or on the outside. Beauty's in the inside too. So we're very into preventive medical management, anti-aging, holistic health care, as well as beauty too, because we all want to look good as well. So today we're going to do a 20-minute transformation on one of our clients, and we'll get to that at the end of the talk. But first we'll give you a little preliminary information on what exactly can we do these days to look a little better without doing something extensive like a surgery, because none of us really want that, right? I've studied locally and abroad with Dr. Kanasopoulos in Greece, Dr. Kardashian in Greece, Dr. Hema Sundaran up in Virginia, Dr. Gravier in Atlanta, Georgia, Dr. Runels in Fairhope, Alabama, and Dr. Patricia Rites from Brazil, as well as Dr. Jacques Lacaze from Belgium. So I bring to the table just some different international and national methods of skin rejuvenation without surgery. Leonardo da Vinci, way back, when he was drawing the face, he realized that there were mathematical parameters around the face, and that these mathematical parameters were exact in certain defined areas of the face, between the nose and the eye, between the eye and the base of the nose, the nasolabial folds, between the nose and the lips, the parameters of the lips from the side, and so on and so forth. And that became something, when we later found out, was the parameters of beauty. So whether it's Angelina Jolie or some of Elizabeth Taylor or some of your international models, those same parameters of the face, called the mask, the beauty mask, can be translated if you take that mathematical equation, which is designed by that engineering mask, and you put it face to face to face on the international models. What you'll find is that every female that we think of as beautiful, although they may not look the same, they have the same mathematical equation. Does that make sense? So the proportion of the eyes from the bridge of the nose, the lips from the base of the nose, so on and so forth, when they are in a certain mathematical parameter, it portrays beauty. If you're not built exactly that way, we can tweak it with a little bit of Botox and fillers. Here's Elizabeth Taylor. Beautiful, very young, and still beautiful as an older adult. Why is that? One of the biggest things is Ageless beauty is due to volume. And when we lose volume, it's like a tire on a car. When we lose volume, air out the tire, things shrink, things fall, they become less three-dimensional, and we look old. By simply taking the volume with fillers and putting it back in the face, we look young again. In addition to fillers, which are temporary, they can bind with your collagen to actually make new collagen beds, and so you actually, it's the gift that keeps on giving. We can do things such as platelet-rich plasma, PRP, radio frequency needling laser, some other different venues that will rebuild collagen and elastin on a long-term basis. So when we're talking about beauty, as we age, and the photo effects of the sun, the environment, the different toxins that we eat and drink, when we want to put some collagen, elastin, fibrin back into the skin, what we want to do is relax the wrinkles, fill the lines, restore the volume, and rebuild collagen and elastin. When we do this, we can turn back the hands of time. Botox is a wrinkle relaxer. So with those heavy movements of the face, those muscles become hyperactive and lines form. When we calm down those hyperactive muscles, the lines fade. If we continually relax the muscles with Botox over time, you actually will cause an atrophy or a weakness in the muscle. That would look horrible in a leg. For example, when we wear a cast, if we had a broken leg, and then when we take the cast off, the opposing leg looks wonderful. Why? Because it was used all the time and the muscle builds up real nice. The leg that had the cast on it becomes weak, droopy, and atrophied and looks awful. What looks awful in an extremity actually looks wonderful in a face. So when we relax the face with Botox several times over the course of a couple of years, we're causing a little bit of atrophy in that muscle, but that muscle was so hyperreactive or hyperactive in the first place, it's what caused those nasty lines that we can descend or take back in time. There's an example of Botox before and after. You can see how wrinkled the forehead and the glabella between the eyebrow area was, and then how smooth she is on the opposing slide. Dermal fillers are used to restore volume. We can enhance the lips, and no, we in our clinics do not build duck lips. We don't want anybody quacking. But if you gently restore the lips, because lips do lose a tremendous amount of tissue over time, gently restoring the lips is very pretty. When you rebuild the Cupid's bow, which is the nice prominent philtrums between the base of the nose and the top of the lip, that is a sign of youth and beauty, which we lose quickly as we age and can be put back in a second. Here's an example of what we were able to do with fillers. If you look in the before slide in that lower mouth, lots of wrinkling, and she almost had a folding over of that lower skin, where we call the marionette area, where you can become sort of puppet-like looking, and in the nasolabial folds or the deeper smile lines. We also enhance the lips just a little, and she looks like a younger sister or another version of herself. This is what I was describing earlier. Some of you may or may not have heard about this, platelet-rich plasma. That's when we take a small, tiny amount of blood, we spin it down in a very special centrifuge machine built specifically to protect the platelets, and what comes from that is platelets filled with stem cells, growth factors, EGF, IGF. What we know about those growth factors from the plasma is it rebuilds. For example, Drew Brees from the Saints this year, he had a bad shoulder injury. The last thing they want to do is operate on a football player, because then that $1 million project, a multi-million dollar project, is out for the season. So what they did do was inject him with platelet-rich plasma, PRP, into that arm. The platelet-rich plasma are sort of like immature baby cells, and they go in there and say, we've got an injury in the shoulder. So what you want me to be is new shoulder tissue, fibrils, tendons, ligaments, you want me to rebuild that, right? And it goes in there and does that action all on its own. So when you take these immature baby cells and you re-inject it into the face, it says, oh, I get it. You want me to be new skin cells, collagen, elastin, young tissue. I can rebuild that. And so over time, it's sort of like putting seeds, fertilizer, sun, and water into your garden. And over time, you rebuild a beautiful landscape. The platelet-rich plasma can be used in any area of the face, jawline, cheek tissue, under the eyes, around the mouth. It's also used dynamically in all areas of the body: neck, cleavage, décolleté, and then in middle-aged people who are going through menopause for women or andropause for men, it can be used to treat the genital area, which if someone were having urine leakage or urinary incontinence, lack of libido, or for the male if they were having issues with performance, it can absolutely help in those departments as well. So this is a little bit what we were saying, contain menopause with the libido issue. Yes?
The PRP, are you using your own blood supply for that? Or coming from
Great question. So the question is for the PRP, are you using your own blood or are you using some outside source? It's absolutely your own blood. So that's the beautiful thing, is because it's totally natural. So we're taking a little bit of your blood, spinning it down and re-injecting it into you. It depends. It would be very much like the landscape at your house, okay? If you wanted to just plant new pansies, that's fine. But if you wanted to build a whole new garden, every time you go out to that garden and weed and fertilize and put new seeds down, you're going to improve the garden more and more and more. Yeah. And for males, it's very, very helpful in the erectile department. Complexion resurfacing. So we've talked a little about rebuilding instantly, calming down instantly with Botox and fillers. For the complexion department, if you've got some aging, some deeper wrinkling, some saggy elasticity, or if you've got some modeling. So what I mean by that is brown spots or red spots or maybe some little scars from acne. Those, we resurface that by using CO2 lasers, radiofrequency needling, microneedling, BBL, broadband light. And those will actually rebuild the complexion tissue. Some of those have downtime, like for example the CO2 laser you'll be peeling for about a week, and others like the BBL, for example broadband light, have no downtime at all. So you could come in and go back out after lunch, go right back to work. In the day and age that we live in, it is very, very common for ladies to have breast implants, whether it's for cosmetic reasons or whether it's after a breast cancer where they've had a mastectomy and then have new implants put in. Regardless of why breast implants are chosen, there are 60% of the women that have breast implants have an issue with them down the line, and it becomes a very shaming disorder, which it shouldn't be. Very often, 60% of the time, one or both will get hard. If it gets hard or lifts out of place, before the only thing they thought could help was surgery, what happens after the surgery? 90% have a recurrence because the issue is a capsulation problem. And we have a non-surgical option for that called the Aspen Deep Ultrasonic Physical Manipulation Medication. It's a whole treatment plan. I bring this breast implant therapy up because I'm hoping to spread the word that there is an answer out there for someone who's suffering with this, who may not be talking about it or may have shared it with a loved one. Please let them know we have a cure for them. Leg vein therapy we also do. It's leg season. Takes about 3 treatments usually. So March, April, May, you're ready for the beach by June. That's a sclerotherapy, so we inject and then we laser on top. It takes about 45 minutes. You can go right back to work or right back shopping. Tattoo removal, that's of course with lasers. Tattoos are so easy to get on and so hard to take off. But with about 10 to 12 treatments, once a month over the course of a year. This is a lady we did, you can see on the left, she had a big angel across shoulder to shoulder, and this is after we finished on the right. Laser hair removal, it's beach time. Takes about 5 to 7 treatments to get the hairs down. Okay, so without further ado, we're going to bring Miss Amy up here, and we're going to do a 20-minute transformation. So first I'm going to be injecting Botox. There are actually 3 different versions of Botox now. So there is Dysport, Xeomin, and the brand name Botox, very much like Kleenex. So there's many different brands of facial tissue, puffs, generic facial tissue, Kleenex. But when we go to grab a tissue, quite often we say, pass me the Kleenex, regardless of what box we're taking it out of. Same thing primarily with Botox. Okay, so I don't know how much y'all can appreciate from there, but can you see how Miss Amy here has some wrinkling of the forehead? Go ahead and make a mad face. And when she pulls in, she's making a lot of wrinkling called bunny lines across the nose. Smile. A little bit of crow's feet here. Put your bottom over your top lip. As we get older, the chin gets hard and it pinches in almost like a golf ball. And what happens with that is you pull down. Everybody wasn't built with a Jay Leno jaw, were they? As we get older, we all become more like Jay Leno's jaw. And the way to prevent that is to put a little Botox in here. So it softens this. When you stop the pulling, you stop the aging effect of those strong chin muscles pulling down. Go ahead and raise your eyes. So I'm just injecting a little Botox across the main muscle grouping of the forehead. Forehead muscles are actually vertical, but they make a horizontal line. The type of needles that we use are extremely tiny, smaller than if you're familiar with a diabetic needle. Oops. So that it's a tiny pick, but it's really not painful. Go ahead and make a mad face. Now, Botox will take 3 to 7 days to take its full effect. You'll notice some immediate slight calming, but its full effect will take it a week. Smile. Smile. Put your bottom over your top lip. Okay, Botox is finished. Good. Now I'm going to place some filler. So what I'm doing now is I'm measuring the angles of her face, because if I just put it in like a cookie cutter, like the little manual that comes with the Botox, that's not how she's built. So it would look good for the lady in the Botox manual, but it's not going to look good on her face. So when we take an approach to anyone's face, we always look at them specifically, and I custom apply it just for them, okay? So I do a lot of measuring and analyzing. I've done Miss Amy before, so I know right where I'm going, but I would do a lot of measuring, and I'd actually mark it out with a cosmetic pencil if she were a new client. She has a lot of lost tissue in the cheeks, which happens so much after the age of 35, and when we put that cheek back up with filler, it just takes many, many years off the complexion, okay? All right. Doing okay? Okay, so the left side of her face is finished. Can you appreciate how we've lifted this? You see? Okay, and I'm going to finish. I won't send her home like this. We'll finish the other side of her face. The product I'm using as a filler, Botox was to calm down the wrinkling. Now what I'm doing at this particular junction of time is we're putting volume back in the face. That's not Botox. Botox calms down wrinkling, muscles that are hyperactive. Now what we're doing is filling. We're putting air back in the tire, okay? And this particular filler is Radius. It's made with a soft calcium. This product has been used in vocal cords and in knee repair for probably over 30 years. I've personally been using this product since about 2002, 2003. I love Restylane, Juvederm, and the hyaluronics. You may have heard some of those products before, for the lips and for under the eyes. But for the cheeks and other cheeks, temples, lower face, anywhere but the lips and under the eyes and the hollow of the eyes, I use the Radius because it's a thicker product. It gives you a much better fill and it lasts longer. And so about approximately 5 to 10 minutes before we started the presentation, we had put numbing cream. So I custom compound a numbing cream, very, very strong, to make it comfortable. Okay, watch my finger. Okay, Amy's finished. There's before. Any questions? Yes, ma'am. Well, Amy comes on her birthday usually every year. That's her treat from her hubby. But I have some ladies that come 3 times a year. I have some ladies that come on an anniversary or a birthday every year. And then I have some diehards who get addicted that come once every couple of months. So, as far as the fillers will last 6 months to a year depending on what type of filler that we use. And then again, so that, well, when will I have to do this? Again, it depends on the look you're looking for. If you really want a lot of volume, you can continually add on. So if you get, for example, if you purchase 2 fillers today, you may want to add another one in 2 months or 3 months down the line. Or it just depends, because some people would like very, very high cheeks. Some people, you know, I just want a little something. I don't want it to look overly dramatic. But what we always go for in my clinic is natural. Because when you make patients look natural and not overdone, that's when they enjoy it the most. People aren't going, what did you have done? They say, oh, you look like you went on vacation. You look great. Nobody understands what has happened because it's a very soft and subtle transformation. Well, it's been my absolute pleasure speaking with you today. And give me 10 minutes and I'll give you 10 years. See ya.